Hi, welcome to the acute care sim rooms. All these rooms are really made to be identical. You should have all the patient equipment you need on the head wall here to take care of your patients during a sim. When you first walk in the room, you'll want to do hand hygiene. You'll also want to identify your patient with their armband and their allergy bands. You'll want to use two patient identifiers, their name and their date of birth. Here on the head wall, all the equipment you might need. We have the hand hygiene, gloves in 4 different sizes, the sharps containers, IV pump, the suction, oxygen, and air all work, and you'll be able to turn these on and actually simulate that. And the oxygen does turn on and goes through the nasal cannula. Then we have the suction canister, the nurse call bell. We also have an ophthalmoscope and otoscope and the probes you need for those. This is your patient monitor. It's going to have your vital signs and the sim time here. There's also a thermometer and a manual blood pressure cuff on the other side there. And you also have a bedside computer that you can chart all your patients' assessments and vital signs. So the beds are all similar. They're not exactly the same. You can move the patient's head up and down. These are typically on the inside of the bar here, and your feet up and down. You can also move the whole bed up and down if you needed to. For insertion of a Foley, you would want to move the bed up. Or for an extensive dressing change. You also want to make sure that these beds are locked, and you control these with your foot here, and they're a little bit different on each of the beds, so you may need to make yourself familiar with that before your sim starts. These mannequins are controlled from the control room. Your voice will be heard in the control room. It is probably being recorded. The mannequins also talk, and they'll be talking to you from the control room. So don't let that scare you when you hear that. Their pulses, they have a radial pulse that you can feel, and they also have a dorsalis pedis pulse that you can feel on their foot. But those are the only 2 pulses they have. So I think that's it. Enjoy.